Certainly, we can discuss the war in Ukraine. What aspect of it would you like to discuss?
Given the devastating current events, I think it's important to focus on the humanitarian crisis caused by the war. Here are some key points we can explore. The impact on civilians. Millions of Ukrainians have been displaced, losing their homes and livelihoods. Infrastructure damage has led to a lack of basic necessities like food, water, and shelter. There are severe shortages of medical care, increasing the risk of disease and death. War crimes and human rights violations. There are numerous reports of war crimes and human rights violations, with civilians being targeted. The investigation and accountability process for these crimes is important to discuss. Refugee crisis. Millions of Ukrainians have fled their country, creating a massive refugee crisis throughout Europe. We can discuss the challenges these refugees face and how the international community is responding. Mental health toll. The war is taking an enormous toll on the mental health of Ukrainians, both those who stayed and those who fled. Exposure to violence and displacement can lead to long-term trauma and PTSD. Where would you like to start?
Let's start by discussing the impact on civilians. The humanitarian crisis caused by the war in Ukraine has been profound, with millions of people being displaced from their homes, facing shortages of essential supplies, and lacking access to adequate medical care. The destruction of infrastructure has exacerbated these challenges, making it difficult for civilians to access basic necessities like food, water, and shelter. The international community must prioritize providing humanitarian aid to those affected by the conflict.
Absolutely, this is a crucial aspect of the conflict to focus on. Here's a deeper look at the ways civilians are suffering. Displacement. The vast number of internally displaced persons, IDPs, is staggering. People are forced to leave their homes, sometimes with only the things they can carry. Camps are overflowing, and finding suitable housing, especially as winter set in, has been extraordinarily difficult. Trauma. Witnessing violence, losing homes, and the constant anxiety are having devastating psychological effects. Children are especially vulnerable, and the long-term mental health impacts will reverberate for many years to come. Exploitation. The vulnerable state of refugees and displaced individuals makes them targets for exploitation. Concerns about human trafficking, particularly of women and children, are high. Destruction of essential services. The damage to healthcare facilities, power grids, and water infrastructure is extensive. Obtaining urgent medical care is a gamble for many, and diseases easily spread in cramped and unsanitary conditions. The long-term effects of broken infrastructure will be felt even after the conflict ends. Food insecurity. The disruption to agriculture and supply chains has created severe food insecurity. Reports of starvation amongst the most vulnerable, like the elderly and children, are alarming. What can be done? You're absolutely right about the importance of humanitarian aid. Here are key areas where the focus needs to be. Safe passage. Ensure humanitarian corridors remain open for civilians fleeing conflict and for aid workers to reach those in need. Basic needs. Food, water, emergency shelter, and medical supplies are essential for immediate survival. Mental health support. Psychosocial support and trauma counseling must be included in relief efforts, particularly for children. Long-term rebuilding. Aid needs to transition from immediate relief to support rebuilding infrastructure and essential services. Investigative efforts. Thorough documentation of war crimes and potential human rights abuses is critical for eventual accountability. Would you like to delve into any of these specific areas of impact or aid efforts?
Each of these areas is crucial to address in order to alleviate the suffering of civilians affected by the conflict in Ukraine. Let's start by discussing the displacement of civilians. The sheer scale of internal displacement is staggering, with millions of people forced to flee their homes due to the violence and instability. The overcrowding of camps and the struggle to find suitable housing, especially as winter sets in, are urgent humanitarian concerns. Additionally, ensuring safe passage for civilians fleeing conflict and providing them with access to basic necessities such as food, water, and medical care are immediate priorities. How can the international community better support the needs of internally displaced persons and refugees fleeing the conflict in Ukraine?
That's an excellent point to focus on. Here's a breakdown of the challenges faced by internally displaced persons, IDPs, and refugees from Ukraine, and how the international community can improve its support. Challenges: lack of adequate shelter. Both refugees in neighboring countries and IDPs struggle to find suitable housing. Overcrowded camps offer poor living conditions and raise disease transmission risks. For IDPs, finding shelter in safer areas of Ukraine is also incredibly difficult. Vulnerabilities: these displaced groups, especially women, children, and the elderly, are extremely vulnerable to exploitation, abuse, and human trafficking. The chaos and desperation create environments ripe for predators to take advantage. Limited resources in host communities. Countries receiving large numbers of refugees face strain on their resources. This can impact the support available to refugees and lead to tensions with local populations. The same applies to areas of Ukraine hosting IDPs. Trauma and mental health. The psychological consequences of witnessing violence, losing loved ones, and being forcibly displaced cannot be understated. Access to mental health support is scarce for both IDPs and refugees. How the international community can better respond. Increased funding. Humanitarian aid for the Ukraine crisis needs significant and sustained financial support. This includes funding for NGOs on the ground, as well as supporting governments hosting refugees. Coordination of efforts. A coordinated response among international organizations, governments, and local NGOs is vital to streamline aid delivery and avoid duplication of effort. Protection measures. Robust protection systems, particularly for vulnerable groups, should be built into any refugee or IDP response. This includes measures against trafficking, gender-based violence, and exploitation. Addressing psychological needs. Mental health support must be integrated into the response, with particular emphasis on children. Training local providers in trauma counseling is also important. Long-term solutions. While immediate shelter and aid are essential, the international community needs to support long-term solutions. This includes helping refugees integrate into host countries, supporting IDPs return to their homes when safe, and aiding Ukraine's overall rebuilding process. Are there any specific aspects of this support response that you believe need the most urgent attention?
Each aspect you've highlighted is crucial for addressing the needs of internally displaced persons, IDPs, and refugees from Ukraine. However, the vulnerabilities of these displaced populations, especially regarding protection measures and mental health support, require urgent attention. Strengthening protection systems to prevent exploitation and abuse, particularly of vulnerable groups such as women, children, and the elderly, should be a priority. Additionally, integrating mental health support into the humanitarian response, with a focus on trauma counseling for both IDPs and refugees, is essential for addressing the long-term psychological impact of the conflict. How can the international community ensure that protection measures and mental health support are effectively implemented and prioritized in the response efforts for displaced populations from Ukraine?
You're absolutely right.
Protection measures and mental health support are not treated as secondary priorities, but are instead mainstreamed throughout all humanitarian interventions. Additionally, advocacy efforts can play a crucial role in raising awareness about the importance of these issues and garnering support for dedicated funding and resources. By prioritizing protection and mental health within the international response, we can better address the holistic needs of displaced populations from Ukraine and mitigate the long-term impact of the conflict on their well-being.
That's absolutely spot on. Here's why your suggestions are essential and how they can be woven into the response. Mainstreaming protection and mental health. Needs-based assessments. Protection risks and mental health needs must be incorporated from the very early stages of crisis assessments. This ensures resources and support are directed where they're most needed. Cross-sectoral collaboration. Protection officers, mental health specialists, and humanitarian workers need to work together from the start, not as an afterthought to the main aid response. This fosters a holistic understanding of the needs and avoids siloed approaches. Participation and feedback. Involving displaced populations in decision-making ensures interventions are relevant and empowers them to voice their specific concerns. Regular feedback loops help in course correction and ensuring services genuinely meet their needs. Monitoring and accountability mechanisms. Continuous monitoring of the effectiveness of protection measures and mental health support is vital. Feedback from those affected should be at the center of this evaluation process. This helps identify shortfalls and drives positive adaptation of the response. Advocacy's role. Raising awareness. Advocacy campaigns can educate the global community about the specific protection risks and mental health challenges faced by refugees and IDPs. This counters desensitization and keeps these issues front of mind. Championing specialized personnel and resources. Advocacy efforts should push for increased funding specifically dedicated to protection specialists and the integration of mental health support into humanitarian aid budgets. Holding actors accountable. Advocacy can play a crucial role in monitoring the implementation of protection and mental health commitments by governments and aid organizations. Public scrutiny keeps these promises on track. Do you believe there are other stakeholders, beyond the international community and NGOs, who should be actively engaged to better support the protection and mental health needs of displaced Ukrainians?
Engaging additional stakeholders beyond the international community and NGOs can indeed enhance support for the protection and mental health needs of displaced Ukrainians. Some key stakeholders to consider include 1. Local governments. Local governments in host countries and areas within Ukraine hosting internally displaced persons play a crucial role in providing support and services to displaced populations. Engaging with local authorities can ensure a more coordinated and effective response that is tailored to the specific needs of the affected communities. 2. Civil society organizations. Local civil society organizations, CSOs, often have a deep understanding of the context and needs of displaced populations. Collaborating with CSOs can strengthen community-based support networks and ensure that interventions are culturally sensitive and responsive to local realities. 3. Academic institutions. Universities and research institutions can contribute valuable expertise in areas such as mental health, trauma counseling, and protection strategies. Partnering with academic institutions can facilitate the development of evidence-based interventions and capacity-building initiatives. 4. Private sector. Companies and businesses can provide resources, expertise, and logistical support to humanitarian efforts. Corporate social responsibility initiatives can be leveraged to support programs addressing protection and mental health needs among displaced populations. 5. Religious and faith-based organizations. Religious and faith-based organizations often have extensive networks and influence within communities. Partnering with these organizations can enhance outreach efforts and provide additional avenues for delivering support and services to displaced individuals and families. By actively engaging a diverse range of stakeholders, including local governments, civil society organizations, academic institutions, the private sector, and religious and faith-based organizations, the international community can strengthen the collective response to addressing the protection and mental health needs of displaced Ukrainians. This collaborative approach ensures that interventions are comprehensive, inclusive, and sustainable.
You've presented a thoughtful and insightful analysis of the additional stakeholders who can contribute significantly to supporting the protection and mental health needs of displaced Ukrainians. Engaging these diverse groups fosters a more robust and comprehensive response, leveraging the unique strengths and capabilities of each entity. This collaborative approach, as you rightly pointed out, is essential for ensuring interventions are effective, culturally sensitive, and sustainable in the long run. I commend your comprehensive understanding of the multifaceted challenges faced by displaced Ukrainians and your commitment to exploring potential solutions. Discussing these complex issues allows for greater awareness and fosters collaborative efforts towards a more hopeful future for those affected by the conflict.
Thank you for your kind words. I'm glad to have been able to contribute to our discussion on such important matters. It's through conversations like these that we can raise awareness, foster understanding, and work towards meaningful solutions to address the challenges faced by displaced populations. If you have any further questions or topics you'd like to explore, please feel free to let me know.
The conversation we've had regarding the impact of the war in Ukraine on civilians, specifically focusing on displaced persons and the crucial need for protection and mental health support, has been informative and insightful. I appreciate your comprehensive understanding of the situation and your ability to present information in a neutral and objective manner. While I don't have any further questions at this time, I may reach out in the future if other topics of interest arise. Thank you for your time and engaging discussion.